Breaking news. The Democratic Republic of Congo has confirmed a new Ebola outbreak, the country's 16th. Already, more than a dozen lives have been lost, and officials warn the numbers could rise. So what's happening on the ground? How dangerous is this outbreak? And why does it matter for the rest of the world? Let's break it down. If you want clear, fact-based updates on global health, hit subscribe and turn on notifications. The outbreak was confirmed this week in southern Kasai province, after a 34-year-old pregnant woman showing symptoms of hemorrhagic fever died within hours of being admitted to a hospital. So far, 28 suspected cases have been reported, with 15 deaths, including 4 health workers. The virus has been identified as the Zaire strain, the deadliest form of Ebola, with fatality rates averaging around 50%. Ebola is transmitted from wild animals to humans and then spreads through direct contact with bodily fluids like blood, vomit, or sweat. Even contaminated clothing or bedding can spread the virus. Symptoms are brutal: fever, diarrhea, vomiting, muscle pain, and in severe cases, internal and external bleeding. Ebola is rare, but when it strikes, it's often deadly. This is Congo's 16th Ebola outbreak since the virus was first discovered in 1976. Some outbreaks have been small, but others, like in 2018-2020, killed over 1,000 people. Globally, the deadliest outbreak hit West Africa in 2014-2016, leaving more than 11,000 dead. What makes the current outbreak so concerning is timing. Congo's health system is already fragile, strained by conflict in the east, and now weakened further by U.S. aid cuts. Local doctors warn they're short on protective equipment, medicine, and staff. The World Health Organization has dispatched experts to Kasai to set up mobile labs, deliver protective gear, and help track cases. Congo does have stockpiles of treatments and the Ervebo Ebola vaccine, which proved effective in earlier outbreaks. But tracing cases is already difficult. Many villagers have fled out of fear, making it harder for health workers to monitor and contain the spread. Local leaders have begun partial lockdowns. Schools are closed, graduation ceremonies suspended, and weekly markets shut down to slow transmission. Health officials are urging people to practice social distancing, strict hygiene, and safe burials, measures proven to stop Ebola in the past. Here's why this matters beyond Congo. Outbreaks like Ebola test global readiness for pandemics. While Ebola doesn't spread as easily as COVID-19, it is far more deadly. And every outbreak reminds us that global health security is fragile. Vaccines, treatments, and international cooperation are critical, because diseases don't respect borders. Right now, the priority is containing the outbreak in Kasai, tracking every possible case, isolating patients quickly, and protecting health workers. If response teams act fast, this outbreak could be stopped before it spreads widely. But delays could mean far more lives lost. So here's the bottom line. Congo is facing another Ebola outbreak, deadly, fast-moving, and made worse by strained resources. But with vaccines, international aid, and fast action, there's hope it can be contained. If you found this breakdown helpful, hit like, subscribe, and share, because the more people understand these outbreaks, the better we can all respond. And let me know in the comments. Do you think the world has learned enough from COVID-19 to handle Ebola outbreaks faster and smarter?